Dr. Peter Glidden, your steadfast advocate for health. Thanks for clicking through. As we move boldly forward here on January the 11th, 2021, into a great political awakening championed by President Trump, lest we not forget some of the players who were responsible for laying the groundwork that got us here in the first place. The coronavirus pandemic, the lockdowns, the mask wearing, the hope for the vaccine, the lockdowns, the mask wearing, the hope for the vaccine, the trumped up numbers of deaths from coronavirus, the misleading information promoted by the powers that be through social media regarding the effectiveness of masks, the necessity of lockdowns, all of that nonsense, which was cherry-picking bad science, quite frankly. Who was responsible for that? Was it the chiropractors? Was it the naturopathic doctors? Was it the Ayurvedic medical practitioners? Was it the herbalists? Was it the homeopathic doctors? Was it the osteopathic doctors? No. It was the MDs and the Allopathic Medical Association and the pharmaceutical industry and the Centers for Disease Control, who have existed in an undisputed monopoly since 1912. That's 109 years of the monopolization of the medical marketplace, which has been in force for so long that most people don't even know that it exists. I'm a licensed naturopathic doctor, but I can only practice medicine in 21 states in the United States. Is that correct? No, it's not. In the United States of America, the only thing that can treat a disease is a drug. Is that correct? No, it's not. Is a free medical market a good thing? Find me somebody who disagrees that a free medical market is a good thing. It's absolutely necessary. But we haven't had a free medical market in this country since 1912, and that's a gigantic problem. Listen, this is not a diatribe against pharmaceuticals. Thank God for lidocaine and general anesthesia and the sterile technique, for goodness sakes. This is a diatribe against a monopolized medical marketplace. If you had a problem with a tooth, you wouldn't go to an orthopedic surgeon for that. If you needed your appendix removed, you wouldn't go to your dentist for that. If you want help preventing and or dealing with a viral infection, the first, second, and third place that you should have gone to is the licensed naturopathic doctors. That's our wheelhouse. That's our strength. Those are the skills, science-based, clinically verified, that we bring to the table. I'm on a support group of my colleagues, hundreds of naturopathic doctors, licensed and regulated, practicing for decades, most. And not one of our patients has needed to be hospitalized, nor has died from coronavirus. Not one. Because our therapeutics are superior to MD therapeutics in this regard. And yet, our voices haven't been heard because we haven't been brought to the table because we haven't had a free medical market. It's that simple. We don't have the cure-all for all human ills, but we are a very sophisticated, science-based, clinically verified, licensed and regulated primary care medical profession whose voice should have been called to the table, whose voice should have been heard, but it wasn't. Because we haven't had a free medical market and the pharmaceutical industry owns the world, for goodness sakes. I've had a proposal before the Trump administration for the last 3 months encouraging the president to create a federal Department of Holistic Medicine to oversee everything other than pharmaceuticals. Right now, it's the pharmaceutical industry and the lobbyists and the people in the Food and Drug Administration who then go to work for the pharmaceutical industry who regulate the vitamin and the mineral and the herbal supplement industry and everything that's not pharmaceuticals. And this is not right. This is the fox guarding the hen house, and it needs to change. If we had a free medical market in this country, the lockdowns would not have happened. The ridiculous mandate for mask wearing would not have happened. Because the science does not support those things. It simply doesn't. And yet, in a monopolized medical marketplace, it's easy to be misled. So when President Trump secures his second term and we, the people, rise up and take back this country for the first time in a long, long, long time, I hope that you will all encourage wholeheartedly the president to take a good, strong look at my proposal to create a federal Department of Holistic Medicine and to make once and for all the medical marketplace in the United States of America a free medical market. I am and always have been your steadfast advocate for health, Dr. Peter Glidden. Please visit my website, riseupintohealth.com, for current information about the simple steps that you can take right now, today, to upregulate your immune system, to make it able to handle viral stress. It's easier than you think. God willing and the creek don't rise, I'll see you next time.